So hospice and palliative care are not quite the same, though they kind of get linked in to be the same. They are both related to comfort care, whether it be for our senior dogs or just any aged dog, any dog with a terminal illness. We can essentially set up for what we call palliative care, which is when at the time of a diagnosis, if we are not to a terminal point, that's when we can initiate comfort care, specifically trying to remedy any symptoms that might be associated with whatever disease process they were diagnosed with. Pain management is huge when it comes to palliative care, and general improvement of quality of life is what we're looking to do. And that, as far as time frame, I do get a lot of questions about that. Palliative care can be from a couple of weeks up to a couple of years. Now, I don't typically recommend palliative care for a couple of years because that to me is just general veterinary care if we're talking years of treatment. But when it comes to someone like myself specializing in that palliative care, we're usually looking at months, anywhere from 2, 6, 8, 10 months of care. And then that may eventually transition into what we call hospice care, which is more of a terminal illness, terminal disease, true end of life care. And our goal there is simply comfort, just like on the human side of things, where we are ensuring pain management. We are ensuring that they are not nauseous. We're ensuring there's not anxiety associated with whatever the disease process is. So that's kind of the two that typically get lumped together because they are comfort care things that we're looking for when we're looking at hospice and palliative care.
So an example could be like a dog that had maybe stage 2 kidney, was having some problems with it. Then they bring you on board, you're supportive and help, especially like with pet parents who maybe have never been through that before, and they themselves have a lot of questions and uncertainties about what they're doing. And then the dog could become very well for a while. So you might see him for a few months, you get him set up, and then they do good. And then later on, they would come back then as a shorter term palliative and then maybe into the hospice.
Correct. When they get into, say, a stage 4 renal situation where we're truly dealing with end of life, and the typical subQ fluids and anti-nausea meds and famotidine, things like that aren't doing the trick any longer. That's when, yes, I would step in as more of a hospice, because that's when we need a lot more monitoring and truly hand-holding, not only for our patients, but for our clients as the caregivers.
And then another one I was thinking of too would be like a cancer patient where they're going through the treatments and maybe they're in the chemo mode and now they have more difficulty moving. They're sick more days because of the medication.
Right.
For a time, and then they too may seem better, get better, or they may not, and so then they would transition.
Do you hear your dog approaching because of the tap of their nails on the floor? Have they scratched you by accident when they jump up to play? It appears that it is time to cut dog nails. Dog's nails should be trimmed on a regular basis because it can result in a lifetime of discomfort. In this next video, we will demonstrate how to cut dog nails step by step.